Good day and welcome to another edition on this program Health 247. I am your host Irene Okechukwu, and today we are going to be taking you on a refreshing health walk being organized by the Limi Hospital in the city of Abuja. We are going to enlighten you why walking is an effective way of staying fit and being healthy. Practically, the Limi Hospital outreach. They're going to be checking people who will come here to check their BP, their sugar level, and so forth. And apart from that, they have also created a forum where they are going to train people on CPR, that is a cardiopulmonary resuscitation. If you don't know about CPR, just stay tuned and watch us. We're going to teach you more on CPR, so stay tuned.
Right? Okay. So then you just slide fingers.
No worry.
Your index, your middle, to the side, just before the big muscle. Can you feel like there's like a groove, something in? Can you feel for it? Just a little. From the trachea, slide to the side. Are you there? Can you feel something pulsating? Please, the doctors, nurses around, physiologists, please assist. Can you feel for it? Because that's what you're going to feel for on the unconscious patients. If you can't, raise your hand. Nurse Peter, where are you? Mr. Elvis, please help her out. If you can't feel it, you have to use it in your emergency. Okay, if you actually have, you can't feel it. Mr. Elvis, help you. Okay, so while we're feeling for that, so we said the first C is check for safety. Second, check for responsiveness. Then another thing is once you check for responsiveness and the person isn't answering, you need to call for help. Because once you start the CPR, we don't want any interruption and you can't do it alone. So the person coming is either coming with an AED, which is an automated external defibrillator. That's if you're in the hospital setting. Or you're calling a 911 where it works. Or you're shouting for help where maybe you're in an open space, you know there are people around because you can't do it alone. If you have your phone with you, Mr. A, Mr. A, no response. Help! Help! Where's Mr. Help! Help! The help is coming with the AED or calling 911 or calling paramedics. Alright, so you're not checking for breathing. So we said the trachea, slide to the side. While you're doing that, you're supposed to be looking at the chest. The reason being that you're supposed to check for respiratory efforts. While you're also doing that, your ears are close to the nostrils. All this should be done in less than 10 seconds. All this should be done in less than 10 seconds. The earlier we start CPR, the better. So once you do that, you can't feel anything. You can't feel the chest moving up and down. Immediately you start CPR. You call for help. The help is here either with the AED or with going to assist you. Even if there's no AED, at least they can start something. They've called the emergency units and go. So another thing we need to know is know our anatomic landmark.
Are you removing the person's clothes?
Definitely you have to. If you
Not say pull up the entire clothes, just open up a bit.
At that point in time, I'm talking of saving one's life. Clothing and all that is the least of your worries. So the whole idea is the landmark is the sternum. There's a bone in the middle, the midpoint of the sternum. You don't want the small bone at the base, the xiphoid, neither the upper one. You want somewhere in the middle of that major bone. Another landmark you can use is the nipple line. So midpoint, the nipple line, you put the heel of your hand there. If you're right-handed, apply pressure there, and then you lock with the second hand. Another thing you need to pay attention to is your elbow. You want your elbow to be straight so that you can apply pressure, and you are almost like over the patient. Your elbow is straight, you're applying pressure, hard, fast. Not too fast, not too hard. We want the chest to still come up for recoil so that blood can flow to the heart. 1, 2, 3, 4, 5, 6, 7. So this is what you're supposed to be doing until you get help. The help will come with the AED. You can then attach the AED. The help can also come with so as to give breath, because what I get is 30 chest compressions and 2 breaths. So basically, even if it's just only chest compression you can do, depending when the person can be moved to the hospital or you have other paramedics to help, that would be very good. But places where you have AEDs, because there are some places where this is at the supermarkets, open places, you can just follow instructions. It has a pad, 2 pads, you just follow the instruction. You have to put it on first and follow the prompts. It just tells you what to do. It's written on it. It shows where to place the pad. You can see it.
Adult mode. Clothing on patient's chest.
Okay.
Plug
So
in
on the
pads
right
connector.
side, on the right side, you put the pad just
Apply
over the
pads to
shoulder.
patient's bare chest as shown.
Here, the diagram is there. Just put it here.
Remove clothing from patient's chest. Plug in pads connector. Apply pads to patient's bare chest as shown.
While this is going on, you shouldn't stop CPR. Not at all. You shouldn't stop CPR at all. So immediately you put the pad, you continue CPR. We don't want any CPR interruption. You should continue, except you're giving breaths or except it's checking for rhythm. That's the only time you stop CPR. But it's just for some few seconds and then you continue. If it's a shockable reading, it will shock. If not, it will not shock, and then you continue CPR until help comes. Our focus today is to know how to do the CPR, because a lot of us might not have access to this. At least know the basic, so that when those that know how to use this come with it, they know what to do. So let's start to know what CPR itself, just the chest compression, is all about. So we said 5 C's. 1 C, the first C is what, please? Second C. Third C, call for help. The fourth C, you breathe in, check for the breathing and the pulse, and the fifth is the CPR itself. All right. Okay, so please let's gather around. Do I need to demonstrate again, or we're good? We just have people watch us while we do it.
Where is she? Are we good? Where is she?
Don't say no, they won't go. At the same place.
At the same place, Okay.
The whole idea of the testing is
Okay,
if
they
you
do
have your
that.
ambu bag. When you don't have the ambu bag, just continue with your testing compressions.
Whatever.
You don't stop. That's why I said you call for
Just
help.
capture the
No problem.
Like if you don't stop, that means it's
You should know what is. You should know what is supposed to be.
somebody save me.
Call for help.
You block all.
Help.
Your ambulance is problem.
Yes.
Okay, so feel for the pulse. Oh, this is
Can even panic? You're supposed to be panicking.
Can you use yourself?
this is your trachea.
Now we see the person is dead.
This side, this is the big muscle. So you're moving to this side. Can you feel it?
Are you walk on the CPR for everybody?
Okay, my name is Ken Willie. Yeah, it's this experience today has been a very, very wonderful experience. You know, it's been a while we had something like this again, but today, man, it really, I can feel it here. There is something, and it's very, very interesting. It's very, very interesting. And please, if you know you are not here today, make sure you make yourself available for next time because it's very, very interesting. I feel very light, like unlike I've not had this training for like up to 4 months, but now, man, today what I have today, I feel very, very free and yeah.
We are one family. This is my eldest son, and this is my younger son. We feel so cool.
Yeah, it's good to make out time to exercise because due to our busy schedules, most times we don't get time to exercise. So this is a very good initiative, giving us an opportunity to come out and take a walk because walks are good.
We do this exercise almost every Saturday, but we're glad to join the walk exercise today. The one this is more organized, as we've seen a lot of families that are present. We do this regularly every weekend, but we are glad to join this larger family. Thank you. If you are not here, you are in a long day, because look at everyone, we're all grilled. Look, can't you see all of us?
Yeah, it's very good.
The Abuja Health Walk is an initiative of the Limi Hospital Group through its subspecialty hospital, Cardio Care Multi-Specialty Hospital, where we come together once a month to promote healthy lifestyle, cardiovascular, and improve our cardiovascular health at large. 1 in 3 people are living with hypertension and they don't even know about it. And hypertension, when not diagnosed early and not started, when treatment is not started early, can lead to a lot of other bad things such as heart failure, stroke, and other forms of cardiovascular disease as well. And so we put together this event to promote a healthy lifestyle, promote exercise. We come together to encourage ourselves while we are doing it. Sometimes these things get difficult if you're doing it by yourself, and so we make sure that at least once a month everybody comes out, does some exercise. We do free health checkups for all our participants as well. We also provide some level of care and also free vaccinations as well, just so that we provide some level of holistic improvement to all the healthcare community at large. This initiative by Cardio Care Multi-Specialty Hospital was put together in particular this month. It's for the World Hypertension Day, as we recognize hypertension as the silent killer, and so we are hoping that through this event people get aware about hypertension, people know to check their blood pressure, people don't take chest pain for granted. Nobody should take chest pain for granted. Nobody should take dizziness, shortness of breath for granted, especially as an adult. Every time you have that, make sure you get an ECG done, get to your nearest hospital, let a doctor review you and check. We invite all people to come around to, regardless of whether you're registered or not. We typically try to register people so that we know how many people to expect, especially because we're providing free vaccinations, free medical checkups. So we want to make sure that we provide everything for listeners. So it's a free event. You can come with your friends, your neighbors, everybody around you. Come together. Let's all promote a healthy lifestyle. Let your neighbor come. You should invite your neighbor. Your neighbor should come so that she or she learns CPR. So that, God forbid, if you are the one that needs CPR or they need CPR, you can always provide that for them as well. Okay, we've been doing this for this is going to our second year now. It's been an exciting experience. The turnout is always massive. We usually get between 300 to 500 people, sometimes up to 800 people that come around just to improve their lifestyle. And it's a healthy community. It helps to improve our diets. It helps to improve our exercise routines, and people to encourage each other to live healthier.
I got to know about this exercise from a friend who saw it on social media, and I'm so glad I came because right now I feel so good. Like I'll feel so refreshed, my body, my mind, and my soul. Please make it a date next year. Don't miss out. It's fun to be here.